Hello and welcome. Today we'll be diving deep into membranoproliferative glomerulonephritis, or MPGN. This mouthful of a name describes a rare kidney disease that can lead to serious health complications. Join us as we unravel the causes, symptoms, diagnosis, and treatment options for this challenging condition. The exact cause of MPGN isn't always clear, which makes it a bit of a mystery. However, we do know that it's often associated with other underlying conditions. These can include chronic infections like hepatitis B or C, autoimmune diseases such as lupus, and even certain cancers. In some cases, MPGN develops seemingly spontaneously with no identifiable trigger. Certain genetic factors may also play a role, making some individuals more susceptible than others. At its core, MPGN is a disorder that damages the glomeruli. The glomeruli are tiny filtering units within your kidneys responsible for cleaning your blood. In MPGN, these filters become inflamed and thickened, primarily due to the abnormal deposit of immune complexes and complement proteins within the glomeruli. This inflammation and thickening leads to a decrease in the kidneys' ability to properly filter waste products and excess fluid from the blood, eventually leading to kidney damage. MPGN is considered a relatively rare disease. It affects both children and adults, but it's often seen in young adults and children. Precise figures on prevalence are hard to come by due to the rarity and varying diagnostic criteria over time. It's important to note that the prevalence might be higher in populations with higher rates of associated infections like hepatitis. The symptoms of MPGN can vary from person to person, and some individuals may not experience any symptoms early on. However, as the disease progresses, common signs include proteinuria, which is the presence of protein in the urine, hematuria or blood in the urine, edema, which is swelling in the legs, ankles, or face, and hypertension or high blood pressure. Fatigue and decreased urine output are also common complaints. Diagnosing MPGN typically involves a combination of tests. A urine test will check for protein in blood. Blood tests will evaluate kidney function and look for signs of infection or autoimmune disease. A kidney biopsy is often necessary to confirm the diagnosis and determine the specific type of MPGN. During a biopsy, a small sample of kidney tissue is examined under a microscope to identify the characteristic changes associated with the disease. MPGN was traditionally classified into types I2 and Decoder based on the microscopic appearance of the glomerular deposits. Type I is characterized by subendothelial deposits. Type L, also known as dense deposit disease, is defined by dense deposits within the glomerular basement membrane. Type E has subepithelial deposits. However, more recent research recognizes that this traditional classification has limitations. We now understand that many cases previously classified as MPGN represent other specific disease entities driven by distinct underlying causes. Therefore, the current approach emphasizes identifying the underlying cause of glomerular injury and tailoring treatment accordingly. The treatment for MPGN focuses on managing symptoms, controlling inflammation, and addressing any underlying conditions. Medications may include corticosteroids or other immunosuppressants to reduce inflammation. Angiotensin-converting enzyme inhibitors or angiotensin receptor blockers can help manage high blood pressure and reduce protein loss in the urine. Diuretics may be prescribed to reduce fluid retention and swelling. If an underlying infection or autoimmune disease is identified, it will be treated appropriately. In severe cases of kidney failure, dialysis or kidney transplantation may be necessary. Currently, there's no known way to completely prevent MPGN. However, preventing or effectively managing associated conditions like hepatitis or autoimmune diseases may help reduce the risk. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can also support overall kidney health. The prognosis for MPGN varies depending on the underlying cause, the severity of the disease, and the individual's response to treatment. Some individuals may experience slow progression of the disease with good management, while others may progress to kidney failure despite treatment. Recent research is focused on developing more targeted therapies based on the specific underlying causes of MPGN. Newer medications and treatment strategies are being investigated to improve outcomes and prevent kidney failure. Continued research holds promise for a better future for those affected by this complex kidney disease.